And I think people are surprised to learn that the highest rates of PTSD occur in African American communities. They're surprised to hear that, because when people think about PTSD, they think about combat. And, I'm guilty of it too. When I think about a veteran, I'm thinking about an older white man, right? But PTSD happens in women, right? Most trauma survivors, especially women, suffer assault. And then Black communities, there's a lot of the systemic racism, the generational trauma from slavery and from systemic discrimination and microaggressions that wear on us every day, right? Black communities and Black people walk around knowing that they're Black and thinking about themselves being Black all the time. I don't think that, many people understand what that's like, right? So that type of stress in itself wears on you and it tethers you and it wears on your very genes, the thread that makes you a living, breathing human. So there are studies that show that. And so, I think that could be very validating. It sounds like depressing and daunting, but it's actually quite validating, especially with my patients who are Black and brown. And I tell them that, like, there's a reason that you're going through this sooner, that your symptoms are more severe because of the history of trauma. And it feels more, I think, acceptable when it's like, okay, a whole group went through this, not just me. And studies show that when a group goes through something together, there's more, it kind of lessens the blow. It doesn't eradicate it, but it lessens it versus it just happening to one person. So I think that information is validating, and also that healthcare professionals need to know this. They need to have that in the back of their head that, okay, I have a patient and she's African American and she's like, approaching her 40s. I have to start thinking about early menopause for her because, Black and African American women go through the transition sooner for longer and with worsened symptoms. And so I think that, that's number one. Number two is that there's a very harmful trope, Black don't crack. One of my good friends who's a dermatologist, Dr. Michelle Henry, says, Black don't crack, but it may sag. And I think that's really funny because she's like, she will tell me that she has Black women coming into her office who are ashamed that their Black is cracking. And she's like, she has to sit them down and be like, listen, that's a trope. Yes, we have melanin and yes, we are, beautiful and have nice skin tones. But again, the history of trauma and systemic racism and the things that wear on you will hurt you from the inside out. So I think that it's important to challenge those misconceptions because a lot of doctors may not necessarily see that outside of a Black woman and say, oh, I should be screening her for perimenopause because she's in her late 30s or mid 40s and she has time, but it's the opposite.
Right.
So we have to arm ourselves with knowledge when we walk into our doctor's offices.
Yes.
And we have to educate ourselves because every woman should know that many doctors only get one class on menopause after they graduate medical school. One class.
Which is mind-boggling.
One class, right? And women spend about half of their lives postmenopausal because we're living longer these days. So that is ridiculous. So we have to walk in with that very scary fact and know that we may have to educate our doctors about our own needs because not the majority of doctors don't know what we know because we're in these spaces.
Yeah.